Good evening, ladies and gentlemen. This is Katyayani, and I welcome all of you all to this very special panel discussion organized by Voice of Healthcare on best practices for early detection of breast cancer at all ages. We would like to thank AstraZeneca for helping us put this session together. Please join me in welcoming our distinguished panelists for today. We have with us Dr. Shivam Shingla, Consultant Medical Oncology, Nanavati Max Super Speciality Hospital, Mumbai. Welcome, Dr. Shingla. Thank you so much for joining us. We have Dr. Pratik Patil, Consultant Medical Oncologist and HematOncologist, Jupiter Hospital, Pune. We have,
Hello.
thank you for joining, Dr. Pratik. We have Dr. Shreya Mallick, Consultant Medical Oncologist, Karkinos Healthcare, Kolkata. Welcome, Dr. Shreya. Thank you for joining us.
Very good
Uh,
evening to all.
yeah. We would also be joined by Dr. Darshana Rane, Consultant Medical Oncologist, Shushruta Citizens Cooperative Hospital Limited, Mumbai. And we have with us Dr. Mubaruknissa Tonse, Consultant Medical Oncology, Asian Cancer Institute at ACI Cumballa Hill Hospital, Mumbai. Dr. Tonse will also be moderating today's panel. So thank you so much, Dr. Tonse, for joining us.
You're welcome. And thank you for having me over and giving me the honor to this. The panel is all about to spread more awareness about breast cancer, and we can detect early breast cancer and save some lives. The whole motto of this entire October month, pink, this thing what we oncologists observe all over the world. So this
Right.
entire panel discussion will focus on breast cancer awareness and prevention and screening, etc. So, shall we start the panel?
Yes, ma'am. Please take over. I hand it over to you.
I guess Dr. Sandeep Ganguly is not available.
No, he won't be joining us. Dr. Darshana Rane would be joining us, and the rest of the panelists are already here.
All right. Okay,
Yeah.
so let's start. The first question will be to my distinguished panelist, Dr. Shivam Shingla. So, sir, I just want to know what are the common risk factors for developing breast cancer? Is there any specific group of patients or uh, population you would want to concentrate more on screening and especially vigilant monitoring for these risk factors and their breast health?
So, good question, Mubaruknissa. Breast cancer, as we all know, is rising in numbers. Today, when we look at India, in Mumbai, 1 in 16 women would develop breast cancer. And this is one of the biggest challenges that we face today in the country. In US, 1 out of 8 women develop breast cancer. So somewhere it is to do with the lifestyle. So the common risk factors are related to the lifestyle that a woman lives. Woman's body is supposed to cater children. Today, women rarely have children or 1 or 2 children. Breastfeeding has become uncommon. The body mass index, the fat ratio have increased, and a lot of women have taken up to smoking and alcohol. Some of the women they go for infertility treatment. These are the common risk factors which put you at higher risk of developing breast cancer. The other reason for developing breast cancer in women is hereditary. Women who develop breast cancer because of a genetic deficiency in their parents, it would have been there in their grandparents or in their paternal uncle's time. Now, with aspect to your second question, who should be vigilant? I think women who do not have children, who are not breastfed, who have got an early menarche, late menopause, these are the women who are at high risk of developing breast cancer. Uh, Especially women who smoke or drink alcohol, have a high fat index, they should be screening themselves for breast cancer. Irrespective of the risk factors, I think all women should screen themselves for breast cancer after the age of 40 years. Thank you.
Exactly. very well put across those points, the risk factors, especially the westernization, modern lifestyle which we have adapted from the West. So certain things which are inherent in nature, like mutations in certain genes which predispose the female for hereditary breast cancer. So any panelist would want to add extra points to this? Most welcome. All right. So let me go on to the next question. It will be to Dr. Pratik Patil. So I guess yeah. So we are about to, like, we started with the breast cancer discussion and its prevalence as it has increased. So why early detection is crucial in breast cancer, and what makes a timely diagnosis a game changer in your practice?
So thank you for the question, Dr. Tonse. So early diagnosis in breast cancer is very important now because, as we know, early detection will save the life of the patient. As we know that breast cancer is one of the disease where even for the last stage cancers, the treatment has evolved very much, and we are seeing a lot of cancer survivors in the stage 4 cancer as well. But if the patient is diagnosed with cancer in the first three stages of the disease, that is stage 1 to stage 3, there's a 100% guarantee that the patient is going to survive for the normal of age and sex. So that is why the importance of early diagnosis is extremely important for a disease like cancer, not just for breast, but all the organ systems. And any female who's diagnosed with stage 1 breast cancer probably would only have to undergo one modality of treatment like surgery, and we could skip chemotherapy and the toxic side effects of it for some of the cases depending upon the patient's exact type of breast cancer. But on an enlarge, I think early detection of breast cancer is extremely important because it gives you a guarantee to a normal life thereafter.
Thank you, doctor. So, what doctor was trying to say is, you know, be it any organ, a tumor which is early detected has a better uh, survival rates. So, if you have a stage 1 breast cancer, obviously the higher cure rates will be higher compared to someone with a stage 3 breast cancer. So, he also wants to stress upon that, if even if you are stage 4 breast cancer, you need not worry and stay home thinking that it's a fourth stage metastatic disease. We have patients who go on to take treatment in the stage 4 metastatic breast cancer, especially hormone positive and HER2 positive breast cancer, who receive therapy for almost like 5 to 10 years and beyond, with newer targeted therapies available with us. Thank you, doctor. So, hi, Dr. Darshana. Are you around? Dr. Darshana? All right, Dr. Sreya Mallick, I'm pleased to welcome you. So, I have a question for you, madam. So, what are some misconceptions or fears that you have encountered that might discourage individuals from seeking treatment or early detection of breast cancer? How can we address these concerns and encourage positive screening in women?
Thank you, Dr. Tonse. So there are a lot of misconception and fears regarding early diagnosis and proper screening. First of all, there is a social innovation, that is, any female patient with breast lump, especially in rural areas, they prefer to avoid to go to any healthcare professional or any hospital to seek help. Secondly, cancer as a disease, because there is a common notion that cancer is incurable. So definitely there is a misconception that if you do the chemotherapy, radiation therapy and all, it will be harmful to the patient. So unless they are seeking help, they are going to some alternative medication and homeopathy and etc. And there is another myth that only older women will have breast cancer. So the young women who are having breast lump, they are ignoring their symptoms and they are thinking it is not cancer. And another thing is, there is also a misconception that if some person has family history of cancer, then only they will have the cancer. So unless and until they have a positive family history, they are thinking it might not be cancer. And another thing is, there is lack of awareness and misconception about the symptoms, because many a times breast lump will not be there. There may not be any breast pain. So there may be nipple changes, nipple retraction, nipple discharge. So if, as the females are unaware about the symptoms, so there are misconception in every level. So that I am facing since last 10 years of my practice. These are the common misconception. And another one more thing, that is diagnostic dilemma, because there is a misconception that if we do the FNAC or core biopsy or mammography, it will spread the disease. So they are not coming to hospitals for early diagnosis, even if they are observing any breast lump or any symptoms. These are the common problems or misconception in the population, so that we are not getting the early stage breast cancer as much as is required for total cure of the disease. And your second part of the question is how to prevent this. So definitely we have to increase the awareness in the society. We have to build the awareness that cancer is curable, especially breast cancer, if we can detect it in early stage. So definitely we have to educate them regarding the need for regular screening, especially with special emphasis on the females which who has the family history of breast and ovarian cancer. And also we can add in some awareness campaign at every level, like rural or any college level or in community level, to discuss the common sign and symptoms, to discuss the importance of self breast examination. We can share some success stories, those who are diagnosed in early stage, those who are doing well. And also we have to make them understand that cancer is totally curable, breast cancer. And also one more thing, we have to educate the community level health worker and the local doctors. These persons are the first point of contact, because many a time patients are not aware where to go. So we have to educate them what are the warning signs, when to refer to the higher center, when to follow the screening guideline. These are the measures we can take to promote the screening guideline and to facilitate the early detection of the breast cancer.
Very well elaborated, Dr. Mallick. Excellent. Challenges faced by doctors who are working, especially in remote areas, because of various stigmas associated with cancer, thinking that it's going to spread, doing a biopsy will spread the disease, and lack of awareness, which is very, very important, especially in the rural areas, and lack of facilities, and even the healthcare providers at a primary healthcare providers who are not aware about the symptoms and signs of breast cancer, and lack of education in the women, all these are contributing to increased detection of breast cancer at a later stage compared to in America or in the Western peer group, where the cancer detection is in an earlier stage, and the survival rates are very higher compared to women in India who get detected in the later stage and get obviously have a inferior outcomes. So we also, she stressed upon points like how to overcome this fear, how we have to incorporate our primary healthcare workers and at community level to hold camps, hold screening programs, and at various levels. This is like really good point madam has made. So Dr. Darshana, hi. So welcome
Hello,
on
hi,
board.
hi, hi, hi,
So,
hi.
madam, are you well? Okay, we'll go on to the question to you. Could
Yeah,
you
yeah,
please
sure.
provide some insights into various screening methods for breast cancer, like mammography, ultrasound, MRI, the pros and cons of each, and how can one make a informed choice regarding these methods?
So yeah, it's a very important question. So basically, what we need to understand that what means by screening. Screening is a way in which one has to know the disease in a non-symptomatic, when the patient does not have any complaints. That is called screening. And usually, what we do is we do ask the relatives to do self breast examination from beyond 20 years of age. So, so beyond 20 years of age is something the lady should know what her normal breasts are, and try to do her self examination every month. So now screening, when it comes to screening beyond 40 in India, we ask a lady to do a mammographic evaluation every year, and this comes in various health packages also nowadays. But it is important to note that in people who have family history, that is those who have relatives with known breast cancer, they could do it a bit earlier, provided there is a genetic uh, confirmation on the primary patient. So yes, so mammography is one important test. In mammography, we do understand that um, um, uh, there are some concerns in young population. So young populations whose breasts are dense, we also advise to do mammosonography and sometimes an MRI of the breast. Um, so screening, as we know, is when the patient is not symptomatic, and then in those patients we try to understand that whether the cancer is there or not there. And in such patients, sometimes we may find a lump, and it need not be a cancer, but we may find a lump, and then we have to do some investigations occasionally. So so there is a mammographic evaluation which tells us whether it is surely a cancer, or it is a doubtful or cancer. So, or if it is not a cancer. So when it is a doubtful condition or it's a sure condition, one has to undergo a biopsy. And so doing mammography does increase the need for the biopsy. It does not mean that the patient will have a cancer, but it does mean that the patient will go through the biopsy. So all this process generally creates a lot of anxiety, and obviously there are some cost concerns in the family, and um in India, some amount of stigma, a social stigma, which do not allow the patients to do it on a timely basis. So all these are the pros and cons of doing a mammography or other screening modalities that we have today. Thank you. We can't hear you actually, Mallick.
Hi. Madam has elaborated that we have three methods employed right now to detect early breast cancer, that is mammography, ultrasonography, and MRI. So, an ideal breast plan consists of self breast examination, having breast awareness, a clinical breast examination, and a mammography. So, self breast, a woman being aware of how her breast looks is very important part of the
Yes.
screening. So, second comes self breast examination, which has to be done in the after 5 to 7 days, during her first 5 to 7 days of the menstrual cycle. It has to be done monthly. Self breast examination can begin after the age of 20. So a clinical breast examination is by a healthcare provider. So there are patient has to be examined, palpated. The both breasts have to be palpated. Both armpits have to be palpated. In the self breast examination, all women, you can get into YouTube. You can watch a video how to do self breast examination and be aware of your breast. So any change in the breast size, any nipple discharge, any lump you feel, any skin changes, ulceration, redness of the breast, hardening of any areas, or you feel any lump in your armpits, you have to immediately concern a physician. Second part's annual breast examination by a healthcare provider for women about 25. So after this, every woman should undergo mammography after the age of 40. So there are concerns about radiation exposure for women less than 40, especially if there is a familial history of breast cancer, or if there is a mutation which is predisposing for breast cancer. But these are not very positive. They have not been studied in any trials. So this will be the ideal breast plan. And as madam has told, if there is dense breast tissue, we also evaluate younger women with ultrasound of the breast and also MRI of the breast if there is a doubt. And MRI also is recommended in women who have familial breast cancers with some mutations like BRCA kind of mutations, where screening is started very early in the life, like 25, from the 25 years of age. And as she said, there are some cons of it. It creates anxiety, it can create some pressure in the family, etc. But I think nonetheless, this is the best thing to detect early breast cancer and to get rid of uh, unnecessary treatments which you might end up having to do if you are detected in the later stage of the disease. uh, so shall we go on to second round of discussions? Shall we proceed? Okay. So, Dr. Shivam, could you please discuss the various screening methods of breast cancer and the accessibility to the different population? Are there any specific challenges or disparities we should be aware of in breast cancer screening?
I think my colleague Dr. Darshana explained very beautifully the different screening methods, including self-breast examination, mammography, and MRI of the breast. The challenge remains is the accessibility. In tier 2, tier 3 cities, MRI of the breast is not very well available or understood by the population there. In villages, mammography is not easily accessible. So what we are doing today is screening these women with the help of mammography vans. We organize camps at different places, and these vans go from village, from houses, from post to pillar, and identify and screen women for breast cancer screening after the age of 40 years. The challenges remain. Nothing is 100%. Uh,
हाँ, ते कट करून टाकले tablets मध्ये.
within the screening program. The biggest challenge which remains in the screening is to get these women to take treatment. We still are able to diagnose a lot of high incidents where we believe that this could be cancer. The challenge remains is to get them to go undergo a biopsy. The challenge remains is to avail treatment options for these women, because there is still a lot of stigma, especially in tier 2, tier 3 cities and villages surrounding breast cancer. I have had women coming to my clinic who have been diagnosed for breast cancer, who knew that they had breast cancer for 3-4 years and they would not come forward for the treatment. I think this is where, as a community, these sessions that we are doing today is useful. Invariably, I've seen when the tumor goes above stage 2, most of the women, they do understand that they've got breast cancer. They see heaviness in the breast, they see the changes. The problem in India is that they don't come forward, and with more and more encouraging sessions, and we are blessed today that we have a plethora of women medical oncologists, our colleagues, female colleagues, who are there to motivate these women to come forward. Sometimes the challenge remains is the gynecologist. They tell these women, that our colleagues, that these are all breast lumps, these are could be post feeding, and I've seen so many women being guided in the wrong way. They said, we went to the doctor, he said that take antibiotic, this is post feeding lump. I think this also needs address. In Mumbai, I feel that women are relatively coming earlier. Uh, the majority of the women do come in stage 1 and 2, but women from tier 2, tier 3 cities and villages, they come in advanced stages. I think this is to do with the stigma, and this is to do with the lack of availability. Uh, I'm very happy that a lot of organizations like Karkinos and other people have taken up screening in a big way, and Dr. Sreya Mallick is from one of those organizations, and she can probably spread more light on how they are doing it. But accessibility to screening and the stigma remains the biggest challenge. And these sessions like this today definitely are going to help us. Another challenge is that men also get breast cancer. And we keep addressing women with breast cancer. I see men coming with stage 3, stage 4 breast cancer, and I'm disheartened. It is such a simple disease to diagnose in men. So another problem that women tell me is that breast cancer happens in elderly ages. Breast cancer can happen to anyone from the age of 18 to the age of 85. It can happen to anyone. I've had women who have had 90 years and they've got stage 2 breast cancer, and I've had women who are 20 years, they have early stage breast cancer. So these are our challenges. Education is going to resolve most of them, and social support is very important. Over to you.
Thank you, Dr. Shingla. That's very well put across. The various challenges faced by oncologists in India when we get patients of advanced stage breast cancer. Why do we get? Usually, it's the stigma associated with the disease and poor access to healthcare, especially screening devices in the tier 2 and tier 3 cities, and trainings for these specializations. So all these platforms are here to make a woman aware about this disease and come early for diagnosis, which can be done by screening. So as he said, even male breast cancers, which we do see in the clinical practice, they are rare compared to women as the gender itself associated disease. But we do see, especially if there is a family history of breast cancer and ovarian, pancreatic, or prostate cancer, such families need to do genetic screening. And if there is a family history of male breast cancer, it's very strongly associated various mutations, and it has to be picked up and treated. So, Dr. Patil, so are there any recent advancements in breast cancer screening techniques that you find particularly promising or impactful? Could you share some examples of these advancements, please?
Okay, so I think the advancement is not a very recent advancement, although something called as a digital breast tomosynthesis, which was also approved by the FDA in 2018 or 19, and it is usually available in many facilities around the city now. So one of the study has found that the two-dimensional mammography combined with a digital breast tomosynthesis, the tumor detection rates in the very early stages of cancers is very, very good, and also the radiation dose that the patient is exposed to is very less, and the overall cost is also very much comparative to the classical mammograms we used to do. So these are some of the latest technologies that have been identified. Also, the other is thermal screening. So the sensitivity and specificity of thermal screening has not been at par as compared to digital breast mammosynthesis. Uh, Although it could be used at the community level, when we are screening a lot of breast cancer patients, like most of the IT companies in Pune and also most of the hospital staff in Pune, we are screening nowadays through thermal scanning. And if we are able to identify any target lesion through those thermal scanners, we further test the patient with digital mammograms. So thermal screening is something which is very, very easy. It can be done by any trained personnel at any centers. A lot of vans nowadays are available who do breast cancer screening on a regular basis at the community level, where more and more breast cancer patients are now being identified at the very early stage of the disease. So I think these are the latest discoveries that we have in the for the breast screening modalities.
Thank you, Dr. Patil. So, women should also be aware about recent advances in screening. Most of the women are scared about, it's painful procedure, etc. But see, we have advanced techniques like the thermal screening. Though this, as doctor has said, the detection, can be a little inferior in the screen, like sensitivity wise, but nonetheless, for mass screening in a larger population, these methods are wonderful when you don't have enough trained personnel to do a digital 3D tomosynthesis or a regular mammography. So one life saved makes a huge impact. So, shall we proceed with the next question? Dr. Darshana, can you share success story or a case where early detection made a significant difference in a patient's breast cancer journey, emphasizing the importance of early diagnosis and treatment?
Yeah, definitely. And these days, we are seeing this early detection more often now. One such very important example that I would want to share is there was this patient who had come to the clinic. She was 26, and her elder sister staying in the US was detected with a BRCA positive breast cancer. When she came to me and I took her history, she also told me that one of her aunts also has a history of breast cancer. So we did a mammographic evaluation, also sent her BRCA testing, and both showed positive remarks. So the BRCA was positive, and the mammography had showed BIRADS 3. We went ahead with the biopsy, and the biopsy confirmed though the size was very small, we could do her surgery on time and also give her the adjuvant treatment. So this was a very important to note that even though at 26 she did not think twice, and I convinced her to undergo the breast conservation surgery, and now she's cured of her cancer. So this is something which is very important, that we should understand that. And yes, she was unmarried, so another thing, but yet I we could convince her, and she's now disease free. So this was a very important case which I had of late. Thank you.
So, as Madam said, early detection, how she could save a young 26-year-old unmarried girl's life, just by simple mammography and a genetic testing, which put her at a higher risk. So, she had to screen the patient at an early age, that is 26 years, followed by a biopsy, which confirmed cancer. She went on to undergo surgery, followed by chemotherapy, and she's cancer free. Such inspiring stories make us go ahead with screening and save many more lives. Hats off to you, Dr. Darshana. That's wonderful. So, Dr. Mallick, so I just want to know, in your experience, what are the common emotional challenges that breast cancer survivors face after early detection and treatment? Are there simple strategies or resources available to support their emotional well-being?
Thank you, Dr. Tonse, for this question. So definitely there are a lot of emotional issues, and which starts from the day of diagnosis and it continues during throughout the treatment and also after the treatment in the breast cancer survivors also. Firstly, it is a life-changing diagnosis. So definitely there are lots of emotional turbulence occurring in the patient and the family also. Secondly, there is always a depression and anxiety which goes on during the therapy, and many patient complains that they are not able to handle the side effects of the therapy, especially for chemotherapy when hair fall starts or any other side effect arises. So they are little bit anxious and they might have plan to discontinue the therapy. So we have to get their support to continue the therapy. And thirdly, there is also some fear of recurrence. Even after they finish the treatment, there is fear of recurrence, fear of death, and also there is some uncertainty and loneliness. Patient may think, what will happen to my family, what will happen to my kids, how should I continue this costly treatment for a long, especially those who are getting trastuzumab for 1 year. These are the challenges. And one more thing, there is issues with body image issues, especially after mastectomy. There is personal issues with partner, emotional bonding may be difficult during this period. There is also sexual dysfunction. So a lot of things are there. And one more thing, as we know nowadays, breast cancer is common in younger generation also. So and we get at least approximately 10% of the patient who are less than 40 years of age, and many of them are premenopausal. So after they finish their treatment, there is one issue for childbearing and breastfeeding. So definitely there is effect on fertility with the anti-cancer therapy. That is a major concern, and that is a negative impact on the mental well-being of the patients. So will we have children, and what will the society think, and etc etc. And there is one more thing. Nowadays everyone are happy with the internet and all, they are google doctors, so they are reading that should I get any birth defect if I had any anti-cancer treatment before. So all lot of things are happening in their mind. And lastly, there is social issue. If even if they finish their treatment, so there is difficulty with coping up with the society, with the workplace, with the colleagues. So these are all the emotional turbulence and emotional difficulty a woman faces from the day of diagnosis till their treatment and after the treatment also. These are the difficult scenarios. And to combat this, there are few support programs also. So firstly, the cancer survivor have to be very active. So get some yogas, get some regular exercise, which will improve the quality of life, reduces the depression or anxiety.
depression or anxiety.
Secondly, patient have to
Secondly,
prioritize
patient have to
the
prioritize the
prioritize the.
prioritize the.
Am I audible or
Am I audible
there is
or
some?
It's echoing.
it's echoing?
Oh, now it is okay.
Oh, now it is okay.
So the patient have to prioritize the self care, so they can engage themselves with some listening to music or gardening, so to relieve the stress. And thirdly, they need some social support in the form of emotional support, like we have to encourage them to talk to your friend, talk to your family member, even if you need the therapist, psychological support, your caregiver or your children.
Or your children.
So share your thoughts.
Share your thoughts.
And
And
lastly, you need
lastly,
to
you
improve
need
the
to
social support, joining a support group. Because if you increase the network of people who can support your emotional turbulence, that will be helpful for the patient throughout his or her journey with the cancer therapy. And lastly, there is one more concern, that is, even if you finish your treatment, you have to continue the regular follow up at a proper time and adhere to the proper screening guideline. And that is the most important thing to prevent recurrence. So, definitely, these are the issues we can handle easily with the patient from the day of diagnosis till their follow ups.
Thank you, Dr. Malik. That was very elaborate. Thank you. So, what Madam is trying to say is, so when a woman gets detected with breast cancer, there is physical, emotional, social, sexual, etc. Many areas of her life are getting affected, including her. Uh, uh, the way a woman perceives herself, her body positivity is lost. So if she feels there is loss of hair, there is a stigma to go outside, mix with people socially. And there are other side effects of treatment like chemotherapy, nausea, fatigue, loss of weight, pigmentation of nails, and etc., which would make a woman very vulnerable and very emotional. At each point during her therapy, she would not just require support from her family members. At times we medical oncologists get our psycho oncologists on board to support them. And these women need to have support groups, breast cancer support groups. So when they discuss their similar concerns, similar problems, issues with their breast cancer support group, they feel very encouraged. And when they see cancer survivors who are living longer, they feel very happy, and they will have some hope. So all these issues of negativity, of requiring follow up, worried about life, worried about what happens to the children, what's going to happen to my future life, etc., the uncertainty in life, all that can be overcome with help of support group, and even having a psycho-oncological support. Thank you, Dr. Malik. That was very elaborate insight into a woman's treatment course, what happens to her emotional and social well-being. And I had really esteemed panelists, Dr. Patil, Dr. Shingla, Dr. Dashna Rane, Dr. Shreya Mallick. It was very amazing to interact, and we all hopefully are able to make some changes in women, those who are able to hear us and access us. We are able to make some changes in their lifestyle and able to screen much more women and detect as early as possible
As
many
possible, many
diseases, even when they
diseases, even
and
when they
prevent them from
and
getting
prevent them
advanced.
from getting advanced.
Thank you.
Mm. Thank you, Dr. Tonse, and thank you to all the panelists for having us here. It was indeed a nice session, and hope tomorrow we start having more awareness being spread to more number of women around. Thank you.
Thank you, speakers. Thank you so much, everyone, for joining us today. And it was a wonderful discussion. Thank you so much, everyone. Thank you so much, Dr. Darshana, Dr. Shreya, Dr. Pratik, Dr. Shivam also. He joined us. And Dr. Tonse for wonderfully moderating today's panel. Thank you so much, everyone. Thank you.
Thank you all.
मैं अच्छा मुझे लगा